Greetings, friends and followers. This is Nurses Talking. I am Dale Barsey. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I'm very pleased to welcome Lynn Stange out of Oregon, USA. Lynn is a registered nurse for 35 years. She's got a bachelor's degree in nursing and a master's in organizational management. She's an entrepreneur and she's the owner of Hospice Quality Connection. And she's worked in areas where she has been responsible for strategic growth initiatives in areas of compliance, quality, and education. She's also a nationally recognized speaker in hospice and compliance arenas. So welcome, Lynn.
Thank you, Dale. It's very nice to be here. Thank you for such a lovely introduction.
Well, thank you for being here. I appreciate it. I appreciate it. But tell me, why are you a nurse? What brought you here?
So I've been a nurse for over 35 years now, and I would say that the beginning was after high school. I took kind of a break and I needed to work, and I somehow, I don't remember exactly, became a certified nursing assistant at a small facility in Scottsbluff, Nebraska. And it was through that I really found my love of working with the elderly in particular, taking care of people. And I really enjoyed that work, but as I progressed with it, I sort of had this light bulb moment that said, you know, maybe physically, et cetera, being a CNA for my career, my life isn't going to be enough. And so then with that, I began pursuing nursing education, and then it just evolved from there.
So I have a question, because once you were exposed, you were kind of hooked. But before you were exposed, was there anything else you thought you might want to do?
Well, so, you know, how, like everyone, when you grow up, I thought I was going to be an archaeologist. I thought that would be fascinating. I'm still interested in history, you know, especially Egyptian history, that sort of thing. So I think that probably stuck with me as a kid the longest was archaeology. So I don't know how I made the leap from archaeology to healthcare, but somehow I did.
Maybe it's just a straight line. You never know.
That's correct. Could be.
So what were the challenges for you though? As a nurse, as a student?
So as a student, I would say, you know, I'm not a very good test taker. So I would say that was challenging for me. So I felt that I had to study a lot and in various ways. And of course, when I went to nursing school, there were no computers. You know, we went to the library and we typed our, you know, our papers on typewriters. So, you know, I would say I had to work harder as a student. Some classes were particularly challenging, and I just had to figure out how to kind of make that work for myself. I also got married while I was in college, and so the end of my sophomore year, so I had 2 more years to finish, and being, you know, newly married was, you know, that had its own set of challenges. So I was working, newly married, and going to school full time. But, you know, definitely well worth it. As a nurse, I would say the challenges that we continue to face year over year is staffing, you know, having enough people. I believe too that patient needs are more complex. You see people outside of the home in conditions that previously they would have been in the hospital for weeks and weeks. Now they go home much sooner. You know, sometimes you have challenges with coworkers or people that you know, you have people with different skill levels, or they want to do things differently than maybe you were taught, and so you kind of have to figure that out, all for the, you know, betterment of the patient and the situation. I've been very fortunate in that I was mentored early on by great nurses when I worked in the VA system in Helena, Montana. I had very seasoned nurses who took me under their wing and who taught me and trained me. And I think that that gave me a really great start. One of the big, I say this a lot of times, one of the big things that has shifted or changed, and in my opinion, not for the better, is that when I went to nursing school and I graduated, at that time, nurses were only allowed to work on a medical or surgical floor. You as a new grad, so you came out and they expected that you work in a surgical or medical arena for a year to develop your skills before you could go into specialty areas such as the emergency room, ICU, pediatrics, OB, whatever. Even though you had those elements in your training, they wanted you to get this foundation for a year in med-surg. And I will say that I benefited greatly from that philosophy. It just made the rest of my nursing career, I believe, go in a much smoother way. Now, and I understand why they made this, I understand the changes, right? With nurse shortages, you have shortages throughout multiple departments in a hospital or multiple areas. So you need to fill those. So you're willing to take new graduates into those specialty areas and train them to that specialty area. So I understand why that shift occurred. But for me, it was beneficial to have that foundation. And then when I went on to work with other people who didn't have that same foundation, I saw them struggle a little bit more with some of those foundational elements that maybe they
Okay.
wouldn't necessarily have had to if they had, done that kind of year on a
Okay.
maybe less specialty unit. So
Okay.
that's my personal opinion. I've been a nurse for a long time, obviously, and I'm sure there's many that would disagree, but that's just something that I've observed over time.
Okay. Okay. And so for most of your nursing career, though, you have been in long-term post-acute care arena.
Correct. So I learned pretty early on. I worked in the VA system, and I worked at a local hospital in Montana. And even though I appreciated that experience, and as I said, it gave me a good foundation, I realized that early on, my heart was toward the elderly. And so I first started working in long-term care, which has its own challenges with staffing and resources and many people that you're assigned to, et cetera. But I had such a love for that. And part of that came from the fact that I took care of my grandmother with Alzheimer's dementia. I shared her care with her husband, my grandfather, for many years. And so that just gave me a different sense of what nursing was, what nursing could be, because I was experiencing it personally. And it just fueled me in the long-term care area, excuse me. Hospice came a little bit later, and hospice came from, actually kind of took me back to my root, which was in the VA system. I worked on the surgical floor, and our ICU was very small, and many times patients were not recovering from their surgeries. And what they would do is, if they needed somebody to sit with a potentially dying patient, they would call out a nurse from the surgical floor to go in there and be with those patients at end of life. And I often, as a newer nurse, was asked to do that. And in doing that and being with patients who were not going to recover from their surgery and did not have family, these were veterans without family connections, that spurred another love of in the nursing profession, of being with patients at that stage. And what I really kind of uncovered is that it was a privilege to be with people at the end of life. It's a wonderful, wonderful, joyous time to be with people as they're born, generally, unless there's complications, et cetera. But at the end of life, it's such a privilege to be with people and their families. It's such a gift. And so I had that little nugget right in my head. And then as I was working through long-term care, we would have patients, of course, that were, seeing the end of their life. And so I would work closely with those. And then that kind of launched me into the hospice arena.
Yeah, yeah. And you mentioned it being a privilege, and it so is. It so is a privilege. It so is a privilege. So you're launching yourself into entrepreneurship, and you have Hospice Quality Connection. What's that about?
So for years, I was a hospice consultant. I focused in the area of quality and compliance. And then I ceased doing that. And so I took a break. And in that break period, it was interesting. The first thing I did was I became a hospice volunteer. I didn't practice nursing for a period of time, and I became a hospice volunteer. And I love that. And then a year into that, I became a hospice bedside nurse, which I had not done in years, but I wanted to. I wanted to go back into the field and be with people and their families, because basically these families are letting a complete stranger come into their life, come into their home, come into this very stressful time, and they welcome you and they want you and need you, and it's just a gift. So I did that for a year and I loved it. And I was on a trip with my husband, and I had this idea, which was, so many consulting firms have to focus on helping hospices when they're having challenges, troubles, etc., and with regulations, Medicare, but there's sometimes this missing element of being able to help with quality, and quality is a necessary part of hospice, and there are regulations that surrounding quality. So I thought, wouldn't it be interesting if I could create this little niche company that really would come alongside hospices and support them in their quality programs and in their quality initiatives. And so that's how Hospice Quality Connection was born.
Yeah, yeah. And it is my understanding that regulations around hospice are very, very oh, what's the word? Strict, for want of a better
Correct.
word.
They're very stringent.
That's the word.
The two most highly regulated healthcare industries are hospice and long-term care. They're very
Yeah,
highly regulated.
yeah,
Yes.
yeah, yeah. So I you've been a nurse now for 35 years. What do you think? I know that nursing is changing all the time, but what would you like to see change?
Well, of course, I'd like to see more people join the profession. I would really like for there to be more recognition of nursing and the contribution that they make to the continuum of care, and respect. And I think one of the things that continues to elude nurses is a work-life balance. I think it's very hard. You meet a lot of nurses who are the primary breadwinner of their family, and some of them are having to work 1, 2, 3 jobs. And it's very hard then when you're raising children, you're in a relationship, or you have your own elderly, loved
Yeah,
ones that you're caring for, etc. So I would really like to see sort of that ability for nurses to have that time to connect with their loved ones and themselves, and be able to spend, as much time doing that as they are caring for others.
yeah, yeah, yeah. And so, as you speak about work-life balance and nurses caring for themselves, I'm just going to skip right ahead and ask you, what do you do to care for you?
So I would say for me, going for a walk, reading, I love to read, connecting with family and friends really helps. I will, and if you're talking about in the moment, when you're in work and there's stress and there's challenges and you're trying to multitask, two things have really helped me over the years. And one of them is going to be kind of strange, but I'll share it. One is I will just separate myself from the situation, if I can, if it's step away or if it's after the fact, sitting in my car or home or wherever it is, and just breathe for a few minutes, just
Yeah,
take mindful breaths to recenter myself. And then one of the things that has also helped me, which is a little silly, is I have found that if I feel particularly stressed in a situation, and I have the opportunity to take a break from the situation, and I if I can go into a restroom and wash my hands in warm water, and just the activity of washing my hands in warm water seems to help recenter me in that moment. And it just takes very few minutes. And then I feel that I'm ready to sort of go out and face that challenge again.
Yeah. And you know, there's nothing silly about that at all. I mean, sometimes once you find what works for you, and it's unique to you,
Yes,
if it works for you, it works for you. And sometimes, even as you talked about washing your hands, and I could think of the symbolism of just washing whatever it was away, you know.
yes, yes.
Yeah,
That's true,
exactly.
very true.
Yeah. So, where do you think? Okay, well, I'll circle back to that, but we're talking about you've been here for this time. You've been in education. You talk about quality. What advice would you give someone who wants to be a nurse?
Oh, I would just say do it. I mean, being a nurse is the best decision I ever made. It's wonderful because of the versatility. You can do so many things within the profession that it it's just limitless. I mean, if you're
Mhm.
interested in environmental, if you're interested in a hospital, if you're interested in community, if you're interested in research, if you want to do education, I would say do it, because it is just, the possibilities are endless, and it has just been the best decision that I've ever made. I've never regretted being a nurse. I've never not wanted to be a nurse. I have never, I mean, there's jobs I've had that I've regretted or not cared for,
I
but
know what you mean.
I have never, not been thrilled to be a nurse, and I've always been proud of being a nurse.
Yeah. So, what I was going to ask you earlier, now technology is everywhere. Technology in healthcare is huge.
Yes.
How do you see it affecting the way we practice nursing or deliver care in the next few years?
So I think the biggest change, or biggest thing that I've seen emerging, is AI, right? I
Mhm.
mean,
Yeah.
so, whether you're a fan of AI or you're not, it's here and it's
Yeah.
advancing. And I would say, there, on one side of it, there is maybe concern that some essential jobs may go away. But on the flip side, I think that there are some elements that will make any practitioner, nurse or otherwise, their jobs easier. So a great example of that is, every practitioner now is required to document, generally, depending on the space they're working in, but generally, you're required to document in some capacity, in an electronic medical record or
Yeah.
some other type of scenario. Well, many nurses are challenged either by time, not having the time to do the documentation they want to,
Mhm.
or they don't really have the ability. They're not maybe a great writer, or they're
Mhm.
comfortable, whatever it may be. AI now being embedded in electronic medical records and these other documentation systems allows the nurse to get assistance, to get support. They can speak into, a device and
Mhm.
it will translate for them. They can write and it will rewrite it for them. It will organize it for them. So I
Organize. Mhm.
believe that it can be a real time saver and a facilitator for nurses who are constantly, on the go, just trying to keep up day to day. So I think that is going to continue to emerge, and I think there's going to be more and more situations in which it will be applied. And my hope, of course, is that it will make things better, and that it's not going to be a negative and take away the personalization that any practitioner, nurse, or otherwise is able to provide the patient and their family. I really hate to see it become, care to become depersonalized, I guess.
Yeah. Because that right there is really, as you said, no matter what the member of the team, that personalization is really the essence of care.
Correct. I
Yeah.
could really see, the AI component taking over even some of the quality pieces, like the chart audits, right? So a nurse,
Mhm.
spends hours auditing charts. AI can do that in a fraction of the time. And then maybe the nurse then compiles the data or puts it together in a report or comes up with the strategies to address, any deficiencies or areas of weakness. But I think there's a balance. If you just had AI doing all of the quality, then you would have, basically a non-person directing your quality within your organization. And I don't know that that would really work very well.
Yeah. 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 Exactly. That has its that those are some of those kinks that I think we're going to have to work out and work out pretty quickly.
I agree. It's coming very fast.
Yeah. Yeah.
Yeah.
Yeah. Yeah. What would you say? What would you say is your greatest, what are you most proud of that you've achieved so far?
I looked at this question before we spoke today, and I had such a hard time with it. I I don't know. I'd like to say maybe it's a combination of things. I can't pin it down to a moment or to, a certain event, I guess. I would like to say that I was a good mentor to younger nurses. I would like to say that I was always open to change and learning, and that when I recognized failures in myself, and the way that I interacted with people, whether it was patients or coworkers, that I took that to heart and did something about it, like tried to be better.
Hmm.
I would like to say that I've had some wonderful teams of people that I've worked with that I count myself fortunate. Um, I would say maybe that I took opportunity, that I saw
Yeah.
opportunity and that I took it and I learned and grew from it, whether it was good, bad, or indifferent. I learned a lot about myself, and I feel that I've made a contribution, maybe in small little breadcrumb ways versus some big, moment or achievement. Maybe it's just little breadcrumbs along the way.
Well, you started out by saying you thought you were a good mentor. That right there for me is huge.
Well, I
That right
hope
there,
I was. I hope I was.
that right there is big. And you know what, I typically, and I ask that question because I think that we go along and we do things and we never pause to even evaluate or see what we have done. And in a way that is part of self-care. It's part of saying, look, I managed to move this along. So good for
Yes,
you.
yeah, yeah. No, you're right. You're definitely right. We don't reflect on,
Mhm.
sometimes it's many years later that you look back and say, maybe that was kind of a big deal.
It comes as part of who I think of who we are. Intrinsically, I believe nurses see something needs to be done,
Right,
and we do it.
right,
And as you
exactly.
say, not necessarily seeing it as a big deal, just seeing it as something that needed to be done. Stepped in and done.
Correct, correct.
Lastly, but not least, Lillian, I've been asking people what they see as the most essential quality of a nurse, what they think of. And I'm asking them for one word. If you could tell me one word, what would that word be?
Openness.
Openness. I don't think I've had that word before. Okay, why openness?
Because I think you have to be open to change,
Mm-hmm.
open to possibilities and opportunities. And then the other thing I think that it really is important for is, we as individuals, based on our own family experience, our own history, we may have thoughts about people, their situations, their circumstance, their choices, and we
Uh-huh.
may not agree with some of those things. But we have to be open to letting that be okay and meeting people where they are, not where
Mm-hmm.
we want them to be, where we think they should be, where we would want to be, but where they are. And I think that that was really brought home to me in this last year, taking care of people in a variety of situations. And you never knew what you were going to walk into in terms of family dynamics, socioeconomic status, et cetera, or belief systems, whatever it may be. And if I had walked into those situations with preconceived ideas, a desire to take over, a feeling need to take over or change the situation, it would have been disastrous. In those moments, you need to connect immediately. So you have to set aside everything at the doorstep. That was always my mantra. As soon as I got out of the car, it was a blank slate. You get to the door, you don't know what you're going to face when you get on the other side of the door, and it doesn't really matter. You have to be open and meet them where they are with what they need or want. And the same goes with job opportunities. It goes with, changing yourself, et cetera. So I would say being open has served me the most.
Yeah. That is true. That is true. Being open. Yeah.
Yeah, I think it's a good word for many situations.
Yeah, it is. It is because you gave the examples of being of pretty much like in home care and whatever, but the same applies in institutions. The same applies when you walk into a patient's room. That situation is different than the person in the room next door. And yeah, you do have to leave that. Once you leave that room, you blank slates next one.
Right. And a lot of times, like you'd get report, like in the hospital setting, for example, you would get report about a patient. And if you went in with the idea that your experience with that patient was going to be the same as your coworker or whomever, it's already tainted, right? It's already set up to be a certain way. But if you leave that and you walk in with openness to see and meet that person for the first time, and you're open to who they are, who they present themselves to be, and then you meet them where you're at, it's going to be a much more successful relationship or encounter.
Absolutely. Couldn't have said it better myself. Lynn, before we go, any gem you'd like to leave us with?
No, I just really appreciate this opportunity to share. I know you've had, many other people that you've interviewed, and I'm sure it's just been fascinating to hear. I mean, I'm always interested in hearing other nurse stories, what's gone well for them, what, didn't go so well for them. So I think this is a wonderful project, and I just appreciate that you're doing this and that you're giving nurses this, format and this audience.
Thank you so much for being a part of it, Lynn.
Yes, you're welcome. And you have a great day.
Thank you. You too.
Okay, bye.
Okay, bye.